Welcome, future nurses. We're about to tackle a super high-yield review of the reproductive system and fetal development. My goal is to give you exactly what you need to know to crush these topics on the NCLEX. All right, let's dive right in.
So here's our game plan. We're going to start with a really quick anatomy refresher, just to get our brains warmed up. Then we'll get into the really critical NCLEX topics, like the placenta and fetal circulation. We'll touch on a few key developmental milestones, and then we'll wrap it all up by testing your knowledge with some practice questions. All right, first things first, let's do a super quick review of the anatomy. We're just going to hit the main structures of the female reproductive system to make sure we have a solid foundation before we start building on it.
Okay, so think of these as the four major players in this incredible process. You've got the ovaries, which are basically the source. They produce the egg and those all-important hormones. Then the fallopian tubes act as the transportation highway, getting that egg where it needs to go. The uterus, that's the safe, nurturing home for 9 months. And finally, the vagina serves as the birth canal. Just knowing these basic jobs is the key to understanding everything else we're going to talk about.
Now that we've got the basics down, let's zero in on a huge NCLEX topic, the placenta. I mean, this organ is amazing. It's literally the fetus's entire life support system, and the way it connects mom and baby is just physiologically brilliant. To really wrap our heads around why the placenta is so important and also so vulnerable, let's look at it through the lens of a clinical scenario. This is something you could totally see on your exam. Just keep this question in the back of your mind as we move forward.
So the placenta is this incredible interface. It's fully up and running by the end of the first trimester, and it handles everything from feeding the baby to taking out the trash. But, and this is the part you absolutely positively have to remember for the NCLEX, it is not a perfect fortress.
And this slide right here breaks it down perfectly. This is a massive topic for nursing safety. You see, while really big things like bacteria usually get blocked, look at what gets a free pass. Of course, you've got good stuff like nutrients and helpful antibodies, but you've also got medications, viruses, and alcohol. This is so important for patient teaching, especially for that pregnant teen in our scenario. Okay, so we've talked about the life support system. Now let's talk about the plumbing. Fetal circulation is another area the NCLEX just loves to test. It's a completely different roadmap than what we're used to seeing after a baby is born.
So, why is it so different? Well, think about it. The fetus isn't breathing air. It's getting all its oxygen from the placenta. Its lungs are just filled with fluid. And its liver isn't really processing waste yet either. So the body came up with this genius solution: 3 special shortcuts, or shunts, that basically create bypasses around these organs.
This diagram gives us a great visual of that really complex pathway. See the umbilical cord coming in? It's full of that rich, oxygenated blood from the placenta. And you can see how the blood flows through these totally unique structures. So let's break down the 3 shunts you have got to know for your exam.
Okay, the first bypass is the ductus venosus. What it does is take that beautiful, oxygen-rich blood coming from the umbilical vein, and it shunts most of it right past the liver, straight into the inferior vena cava. Why? To get that good blood to the heart and the brain as fast as possible.
The second one is the foramen ovale. This is basically a little trap door, an opening between the right and left atria. It lets that highly oxygenated blood move directly from the right side of the heart to the left, which is a super efficient way to bypass the lungs. This is all about getting the best oxygen supply to the brain and heart first.
And our third and final shunt is the ductus arteriosus. This little guy connects the pulmonary artery directly to the aorta. So any blood that didn't already cross through that foramen ovale gets diverted here, again shunting it away from the lungs and out to the rest of the body. It's just another clever way to bypass those non-working lungs.
So how does all this blood travel back and forth? Through the umbilical cord, of course. And here is a classic NCLEX mnemonic you have to burn into your brain: AVA. 2 arteries and 1 vein. And just remember, the 2 arteries carry deoxygenated blood away from the fetus back to the placenta. The 1 vein carries all that good oxygenated blood to the fetus. Do not get this mixed up with adult circulation.
All right, let's switch gears and look at some key developmental milestones. Now, for the NCLEX, you don't need to memorize every single detail of every single week, but having a general idea of the major events gives you really important context for fetal growth and viability.
I mean, just look at this progression. It's pretty incredible, right? By just week 8, every single organ system is already there in its basic form.
By week 12, you can recognize the sex. A huge one for us nurses is week 20, when that heartbeat is finally strong enough to be heard with a regular fetoscope. And then week 28, that's a major point for viability, because the lungs are now developed enough to potentially handle breathing.
And speaking of the heart, knowing the normal fetal heart rate is an absolute must. You have to know this for your exam. The normal range, when the baby is near term, is between 110 and 160 beats per minute. But, and this is important, remember that it's way faster earlier in the pregnancy. In that first trimester, it can be up around 160 to 170.
Okay, you've put in the work, you've reviewed the anatomy, the placenta, that crazy map of fetal circulation. Now it's time to put that knowledge into practice. Let's do a few NCLEX-style questions and see how you do.
All right, first up is a select all that apply. You know the NCLEX loves these, so take a moment, read through each of these options really carefully. Which of these statements about fetal circulation are actually correct?
And the correct answers are 1, 2, and 4. Number 1 perfectly describes the job of the ductus arteriosus. Numbers 2 and 4, that's our AVA rule right there in action. Number 3 is tricky but incorrect because the heart rate is actually higher in early pregnancy. And number 5 is wrong because there's only one vein.
Okay, next up. This one really focuses in on just one of those 3 shunts. Which one of these statements correctly describes the ductus venosus? And you got it, the correct answer is 3. Remember, the ductus venosus is the one that lets blood bypass the liver. Option 1 is describing the ductus arteriosus, and option 2 is the foramen ovale. Great job keeping those straight.
And for our last question, let's bring it all the way back to that clinical scenario we started with. What is the absolute #1 priority teaching point for a pregnant adolescent who's using substances?
The correct answer here, and the most critical safety message you can give, is number 3. The big takeaway from all of this isn't just about memorizing facts to pass the test. It's about knowing this stuff so you can provide safe, effective patient teaching. That patient needs to know the placenta is a gateway, not a fortress. So I'll leave you with this. How are you going to apply this knowledge in your own practice?